In this video, we will be demonstrating a minimum assist supine to sit transfer following a total hip arthroplasty with posterior approach. There are several precautions to consider with a posterior approach. The first is to avoid any hip adduction past the midline. Notice how the therapist is allowing the patient's hip to adduct. This is incorrect and could cause displacement of the hip. The second precaution is to avoid any internal rotation of the hip. Here, while being positioned in the side lying, the patient's hip is both adducted and internally rotated. This is incorrect. Side lying can be a dangerous position and should not be attempted without a device in place to prevent adduction and careful guarding by the therapist. The third precaution is to avoid any hip flexion beyond 60 to 90 degrees. Here, as the patient completes the transfer, her hips are flexed beyond 90 degrees. Again, this is incorrect. We will now demonstrate the proper technique for completing this transfer towards the unaffected side. The first step is to remove any pillow or wedge from between the patient's leg and place the affected hip in a slightly abducted position. Second, have the patient prop up on both elbows. Third, while maintaining a semi-reclined position, the patient moves their affected leg off the bed while the therapist guards the unaffected leg. Fourth, the patient moves their torso while the therapist assists in lowering the affected leg, being careful not to adduct. Notice how the patient ends with their leg in an extended position. This helps prevent any excessive flexion at the hip. We will now demonstrate the entire transfer from start to finish. First, remove the pillows or wedge and place the patient's leg in a slightly abducted position. Have the patient come up onto their elbows in a semi-reclined position and gradually move their unaffected limb off the bed. As the patient rotates their upper body, the therapist assists in lowering their affected limb, leaving the knee in an extended position. We will also demonstrate how to perform this transfer towards the affected side. This transfer also begins with the patient's leg in an abducted position and having the patient come up onto their elbows. The therapist assists in lowering the affected limb while the patient rotates their upper body. Again, the knee is left in an extended position.